Good morning. This is Steve Stites, the Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Of course, Hawkeye's on my right, and on my left is Stefanie Baines. She's the Education Coordinator for the Poison Control Center, and she's with us. She has some very special guests that are here with her today. Well, actually, they're at home, I think. You'll want to stay tuned. But first, how do we do overnight, Dana?
We could have done better. We could have done better.
You're just laughing because that's what we just saw on the screen, right?
They're
big
so
guy?
cute, and they're smart. So
Yeah.
good. They'll help us. Yesterday I believe we had 36 patients in the hospital.
We did.
We have 40 patients in the hospital.
That's our
now.
highest number to start a day.
Yes, and we've had to overflow our ICU into another ICU. So right now we have 40 patients, 18 total in the ICU with 6 on the ventilators. Only 30%, that's good.
It is
But if those ICU numbers go up and that's still 30%, those ventilator numbers go up. Unfortunately, we still have 6 people who meet that recovery criteria and on the ventilator too. So that's 12 total ventilators.
Yeah, from COVID, that's
Yep.
a lot.
And we still have 31 patients in-house who are in that recovery period. Now, Hayes has gone up in their numbers as well. They've increased. So right now they have 21 patients in the hospital, 19 are active infections, and they have 2 patients on the ventilator. So both here and there, the overall acute COVID numbers have increased.
Here, there, and everywhere, I'm
Yeah.
afraid, is really what we're
Yeah.
facing. Well, let's first see, before we start the rest of our program, if there's any questions from reporters. And just to say, we have a stand-in today. Jill's not here. Bob Hallinan is one of our outstanding folks here in our media center. Will be
Glad to be here. Do we have any reporter questions?
Yeah, let's start with that. Reporters. Okay, that's clear.
We have several community questions, but we want to get to our guests first today.
You bet. So, Stefanie, this is the time of year you spend a lot of energy trying to keep kids safe from Halloween mischief that could harm them. How has COVID-19 impacted that work?
Well, for us in the Poison Center, Halloween is still one of the most exciting nights of the year. So we know this year's festivities are going to look a little different, but we still have the same potential Halloween poisons that we've always had. So I brought my friends Hunter and Scout today to help share these potential poisons with you.
Yeah, okay,
And,
who's Hunter and who's Scout?
The dog.
Hi there, I'm Hunter,
Hi, Hunter, how are you?
and I'm doing pretty good. Yeah, and I'm Scout. I'm the
Hi,
cat.
Scout.
Yeah,
Cool.
He's the cat.
You know, I have a dog and cat at home, too, and I love that. I love that. Go ahead.
Hey,
No, well, I think they too want to stay safe this Halloween, so they actually have some questions to start to ask you guys, so they can stay safe as well.
All right. This is awesome. My
Yeah,
dog
okay.
asks me questions, too. My cat ignores me, but my
oh
dog
yeah, we're as it should be. Anyway, so so our family likes to go trick or treating with friends. Is that still okay to do?
You know, I think we've been saying it's
Yeah.
okay as long as you know who's in your bubble and you try to keep your masks on and try to stay safe out there. I think that makes a huge difference. Hawk, what do you think?
Yeah, I think we have said that it has been. If you are in your own bubble, you're in your own family unit, and you are going house to house, that interaction with somebody else in the other household is going to be very brief. Now, there has been some other guidance coming out where it is liked to, if that trick-or-treating is reduced this year because the spread has gotten to be so big. But a lot of that has to deal with going trick-or-treating in other groups, meeting with large groups of people doing that activity.
I think if they're like, for example, friends you're always with every day anyway, then being in trick-or-treating is not going to change that dynamic. But if it's a bubble in which you're bringing in people from the outside, that's probably a little dicier.
Yeah.
We probably wouldn't do that as much. But wearing a mask,
Yep.
trying to stay 6 feet away when you go up to somebody's door, and hopefully they've got that little magic claw or something to put the candy into the bag as much as possible. Just trying to make it as safe as you can. Nothing's ever without risk, and certainly if you're somebody who has some illness, your kids have some underlying disease, then you may think it's probably best not to do any trick-or-treating. But I think you can try to keep it pretty safe, and we know that that's an important tradition. And even during the midst of a pandemic, sometimes you got to have a little bit of fun out there. So, did that help, Hunter?
Yeah, but oh, sure. But what about giving out candy? How can we do that safely? You said something about some magic claw?
Yeah, well, that was my made-up thing. I don't know.
Yeah.
I think just trying to stay
Oh.
6
That
feet
distance,
away
yeah.
is it. Yeah. And I'm not
Oh, I
going to push my
see.
cat out there to give him candy. I'm not doing that. But I've heard some people say, well, I'm just going to take a little scoop at the end of a broomstick and take it out there and dump food in the candy, or use some sort of a device like a piece of PVC piping that you put it on one end and it slides right into somebody's bucket. I mean, people have come up with
Yeah.
all sorts of ideas. I'm so accurate in my throws, I just throw it right to them. You saw me throw a baseball once, and I think I can hit most of the trick-or-treat buckets. No, I
Absolutely.
can't, not at all. Go ahead.
Yeah, I think, again, the mask is going to be important for the person in the house giving out the candy. That interaction is going to be extremely brief. So with the masking, with the short duration of time, with the trick-or-treaters going to be outside, you will kind of be on the other side of the threshold inside. That is the way that you're going to be safe, but make sure everybody, and hopefully the kids will have masks on, because again, they're going to be trick-or-treating. You may want to have a mask on with part of a costume, but even if not, make sure to wear your other regular daily mask as well.
All right. What other questions do y'all have?
Well, you're talking about masks, but will a mask that's part of a costume, will that keep us safe?
I think we would say you're going to have more than a mask for a costume, because most of those masks have holes for the mouth and the nose, so that really won't do much. You might have to have some kind of a cool mask you've made up of your own that looks a little like Halloween that can help you do it. Some of the guys around here wear these black masks. That's probably could use or something like that. But I'm not sure our little yellow surgical masks would add much to your Halloween costume, if you know what I mean. But I think if you can find, but I think that just a Halloween mask is not really going to keep you safe.
Got it. Well, it's probably, though, not a good idea to, if you've got one of those, those COVID masks, those little cloth masks, you probably shouldn't use markers on it, though, because you could breathe that in. That could be toxic.
Yeah, I
do you
think,
think
we
about
should
that,
avoid
Bob?
painting or, I don't know.
Yeah, always use non-toxic paints and markers for sure. You probably don't want to mark it up and do anything that would maybe decrease the integrity of the natural mask as well. So I think that's one thing to consider.
So, so that's trick-or-treating, but what are some other activities we could do to stay safe?
Well, that's a great question. Well, for Halloween, I think you can do some cool things around your house. So here's an idea. I've heard a couple of families who have talked about combining Halloween and Easter to have Hallow-Easter. I don't know, that's what, maybe Easterween, I don't know. Easterween.
Easter.
But they're hiding the holiday candy, the Halloween candy around the house, and they treat it kind of like trick-or-treat suddenly becomes an Easter egg hunt. I think that's one way to think about a way to stay safe and have a lot of fun at home.
Yeah, I love Easter egg hunts. I'm still finding eggs from last Easter.
Boy, are
You guys smell them.
How are they there, Hunter? Are they good?
Oh, they're delicious. They're delicious.
Ugh. Dogs
Well,
are.
that's awesome.
Yeah, dogs do that.
Yeah.
What other questions do you all have?
Well, that's all the questions we have, but let's see. So, Stephanie, we've been talking about how kids can stay safe from poisons during Halloween, haven't we?
Yeah, absolutely. Yeah. So at the Poison Center, we typically see an increase in calls, excuse me, about glow sticks, Halloween makeup, and medicines, because there's lots of medicine that looks like candy. And so I think Hunter and Scout want to share how the kiddos can stay safe, and then I'll add at the end how the parents and caregivers can help keep everyone safe. So
I love it. Let's do it.
Yeah. All right. So it's important to play it safe at Halloween when it comes to poison. Now, what do kids like most about Halloween?
Oh, zombies. No, wait, vampires. No, vampire zombies.
This might be a long shot here. I think maybe the answer is candy.
Oh.
Yeah, that's right. Halloween means there's more candy in the house, and you need to be sure that what you are eating is actually candy.
Yeah, some medicines and drugs might look like candy, but they aren't. If you eat medicine when you aren't supposed to, you could get very sick.
Yeah, so be sure to ask a grown-up before you eat anything.
Ever dress up on Halloween?
Oh, yeah. One year I went as something really spooky. A labradoodle.
Oh, hey. I dressed up as something spooky too.
What's that?
A veterinarian.
Ugh. Yeah. Well, dressing up in costumes and putting on spooky makeup is a fun part of Halloween.
Right. But did you know that makeup can be poisonous?
It can.
Yeah. Only use new, non-toxic face paint on your skin. And if your containers of makeup are expired, be sure to throw them away.
Huh.
Well,
Good
that's
tip.
probably
Yeah.
good advice. We tell people that about meds all the time.
Yeah.
So what do you do about decorating your house?
Oh, we love to decorate our house for Halloween. Sometimes we use dry ice to make a spooky fog.
Ooh, that is
Yeah.
spooky.
Yeah, dry ice can look really cool, but remember that it is super cold. It's so cold that touching it can hurt your skin.
Ooh.
So always wear gloves or use tongs when handling it. And never use it in a small enclosed space.
Like a doghouse.
Yeah, like a doghouse.
Yeah. Oh, it sounds like we probably shouldn't try to eat dry ice either.
No, nobody wants a frozen tongue. Ugh.
And when it gets dark outside, do you ever use glow sticks?
Oh, yeah. Glow sticks can help others see you if you are outside after dark.
But be sure to let a grown-up help you activate a glow stick. Never chew on a glow stick.
Yeah, it could break and get the liquid inside all over the place. Or it could cause irritation if you get it in your mouth or in your eyes.
So team here, what can you do if you or someone you know has touched or gotten poison in their mouth or on the tongue?
Well, you can call the poison helpline, can't you, Stephanie?
Absolutely. So we would recommend that anyone, if they think they've been exposed or have questions about exposures or have in fact been exposed to a poison, that they call the poison helpline. Our specially trained nurses and pharmacists are available 24/7, and all calls are free and confidential. In addition, I wanted to add, they had some great tips for the kiddos, but just for the parents, I wanted to remind them to store all medicines locked up and away because kids are in candy mode right now, and a lot of medicines tend to look like candy. We do recommend that they use the glow sticks. They can help them see and be seen, but we don't want them to put them in their mouths or chew on them because they could break open. And as they said, the contents can be irritating to their mouth or eyes. If they're using dry ice at their party, we don't recommend that they put it in individual cups because we don't want anyone to drink that. And always use the non-toxic face paint or things that are actually designed to be on your skin. Don't use like regular spray paint on your face or body. And then remove it at night before you go to bed so it doesn't cause any irritation. And if you're having a socially distanced party as adults, if there's alcoholic beverages involved, we would want to make sure that you store all those up and out of reach and make sure you clean up at the end of the night. And then our last tip would just be to be prepared. So we encourage everyone to program our poison helpline number into their cell phones so they have it just in case. The number is good nationwide. And that number is 1-800-222-1222. And we're happy to help.
222-1222.
Yeah.
I can remember that until I forget it, so I'm going to program it.
Program it in your phone. You'll be ready.
Outstanding. I want to say to Hunter and Scott, first of all, I love the decorations at your house. The leaves, the boo, all the orange, and the little spider web behind you. It feels kind of like Halloween. There's even a pumpkin,
Yeah.
huh? Very cool. You guys worked hard at that.
Oh, thank you.
Yeah. We like to get out our decorations every
So
year.
here's what I want to know is,
Yeah.
which one of you cooks and which one of you cleans up?
Cook?
Clean up. We're pets.
Yeah. Humans wait on us hand and foot.
You got some human service.
We
is
just
what I
got-
hear
We
you say.
just got. Oh yeah, we just wait for the can to be opened.
Yeah.
I like it.
And then, to clean up, I've got a little box over in the closet.
And I got to go outside.
Yeah.
Well done. Well, stay safe from COVID out there. We know that sometimes pets can get it too, so make sure you wear your mask when you go outside. You're around others.
Okay.
Okay, yeah.
Yeah.
Cool beans. Thank you, guys. All right. Bob, let's see what questions we have from the community today.
All right. Well, we noticed, Doctor, that you have voted already.
Yes,
It says
I
so
did.
right on your coat.
Yes, I
Good for
did.
you. A question that we've had from several people, are voting polls considered super spreaders?
I don't think voting polls are considered super spreaders. You know, voting is something, and I'm getting out of my lane here a little bit. I'm a doctor. What's that line from Star Trek? I'm a doctor, not a physicist. So I'm a doctor, not a politician. But, you know, voting is just so darn important. And I think one of the questions is, can polls be safe? And I will say, I went to Union Station to do my absentee ballot, and I thought that was like incredibly safe. I was so impressed. People were all masked. They were wiping down every surface. They, you know, nobody else touched my polling card but me. I was 6 feet apart at all times. I mean, they did a great job. And I think what I'm hearing from others who have done the same thing in both Missouri and Kansas is that it really has felt safe. I believe that so many efforts have gone into place to make sure that voting is safe, that absolutely, I think, especially during the midst of this pandemic, I just don't think that voting's ever been so darn important. Everybody needs to let their voices be heard, and Republican, Democrat, what have you, get out there and vote, and I think you can be safe, Hawk.
Yeah, you know, again, we both voted early.
Yep.
You know, I was in Johnson County, and, you know, I think all over, though, just as in schools, every place, every voting commission or county has taken really good steps to try and ensure the safety of people. And when I voted, everybody was in masks except for 2 people, again, that were in face shields. You know, that doesn't really constitute barrier protection. So everybody needs to be in a mask, and I'm sure they will when they're in line. The line moves through pretty quickly. Now, there may be some differences from Johnson County or Union Station to other urban areas in large cities or anything like that. But again, the important thing is I think all these commissions have taken good steps and promoted these good steps to try and ensure the safety of voters.
Yeah, I think it's the right thing to do, and I think it's a safe thing to do, and I believe that we can. I don't believe that this will be a super spreader event. And just to call out, I know in Jackson County, Arrowhead Stadium is now available, and the Chiefs have turned Arrowhead Stadium into a polling place. And I don't know all the details about that. You'd have to go Google it online, but I think lots of different folks can go out there and vote.
I've heard that Wichita is setting up field hospitals. Is it really that bad, and what does this mean?
You know, we have been in touch with some of the folks in Wichita, and it's what you've been hearing us say. It's harder. This is probably as hard as it's been since the very beginning of the pandemic when it was spreading. And you're seeing this in multiple cities throughout the country. People are talking about having to put more measures in place. You saw Europe, they were closing bars and restaurants in many cities in the United States. They're rolling back the time and the occupancy and going to essential businesses only. And it's because there is another wave, or whether it's the same wave or just a surge, I don't care. It's just there are some more people out there with coronavirus. The numbers are up by 40 or 45% in the rolling 2-week average. So that means if you compare this 2 weeks with the last 2 weeks, we have 40 to 45% more people that are testing positive for the coronavirus. And it's not just a question of, it's not just a question of testing. It's a real challenge that we're facing because there's more positive COVID patients out there, which translates into more hospitalizations, which then creates a problem around ICU bed capacity. And it's happening at a time of the year when the hospitals are just full. And I think that's been our struggle here, and we know that there are people that we couldn't get transferred into our hospital or into Kansas City from outside hospitals that needed more advanced care, and it's because we're full. So I think that is a sign of that down in Wichita. I think putting up a field hospital in Wichita, Wesley and HCA, the HCA hospital and Via Christi, which is an Ascension hospital, have both. Those are both good hospitals, and I think that they are facing that bed crunch. And those conversations are starting in Kansas City because we're all facing the same bed crunch, and everybody's working hard to try and make sure we can have capacity if these numbers continue to increase. The good news is that Kansas City, you have bent the curve before, and you know what to do, right? And we have to stress that. Hospitals cannot bend the curve. We're here to take care of folks when they're sick. There's only one group of people that can bend the curve, and it's you. And we know what the measures are to bend the curve because we've done them. And we know that when those measures are followed, communities stay safe. there's a thing that came out yesterday that said masking reduces infection rate by 40 to 50% in Kansas, and whether that's right or wrong, but it does indicate an exact number. But there are so many studies out there that show the effectiveness of masks. It's just unquestionable, and I'm always irritated when I read the paper or I read some other person out there. I was looking at, it was the Wall Street Journal today, and it was questioning the efficacy of masks. I'm like, really, come on, let's get over that question.
Yeah.
There is just no question about that. So masks make a huge difference. Distancing makes a huge difference. And as you've heard us say many times, there's still no place like home. And I think we really need to go back and say we've got to focus on bending the curve because we don't want to see society shut down. The only way to make that happen is for people to follow the rules of infection control because we can master that. And so, Hawk, further thoughts around that?
Yeah, I mean, there was even a smaller study early on in the pandemic that looked at the Illinois-Iowa border that looked at when mask mandates were put in. Illinois did put one in because, remember, Chicago got hit pretty hard. Iowa did not, and they showed that the rate of increase of spread of the disease was greater in Iowa after the mask mandate was put in Illinois. So we know it, and there's more and more mounting evidence. Initially, there wasn't a lot of evidence about SARS-CoV-2 in masks. That population and individual data and research studies are being published more and more now. So it is actually true, and we need to continue to do the right things, especially as we move now into the colder weather. Obviously, Halloween is going to be this weekend. There's going to be a lot of parties. I would probably advise everybody not to go to those parties. Meeting and gatherings, the chance that somebody at that party is going to have, or that gathering is going to have SARS-CoV-2, COVID-19, is probably pretty high. We've seen that because as the spread in Kansas City area has gotten more, the chance that someone in a large gathering is going to have that, or 2 or 3 people, is greater and greater every day.
Yeah, it's really important. And so again, Kansas City, it's what we said before, BKC, we really need to bend the curve and following those rules of infection prevention and control, bend the curve and keep us safe. And I think there's a couple important points to be made. There's some really important therapy on the horizon. You and I have talked before about the importance of monoclonal antibody therapy. Mario Castro's been on the program. Madia Salate and Dr. Ojo were on the program earlier this week. In the New England Journal of Medicine yesterday was a phase 2 study in which they reported the results of how the monoclonal antibody therapy lowered the hospitalization rate from 6.3% to 1.6%.
Yeah.
That's a huge difference, folks. There is hope on the horizon, and it's important hope because those monoclonal antibody therapies, I mean, by all indications, look like they're going to be effective. And I think it's still probably December, January or so. I think the early use authorizations are into the FDA. Or will be going in. So this is really important. And so we have to work hard to stay safe now. Because I think we're going to see a point in the next 3 months or so, and maybe sooner, that when those monoclonal antibody therapies start coming out to market, that I think they're going to help things a lot, Dana.
Yeah, absolutely, and that's part of the study that Dr. Castro is a part of.
Exactly.
So, but we have to understand too that the young people are getting it. Okay, they may not be hospitalized at the rate of the older populations. I had a 44-year-old patient in this week. But there's good evidence, there continues to be evidence, that the young people spread it to those other vulnerable populations, whether that's older populations and other people who have comorbidities that put them at higher risk of infection as well. So while the individual may not be at risk for severe illness, it easily spreads from that individual to those other vulnerable populations.
Becca's wanting to know, our tennis club is moving from outdoor courts to domed coverings. And they say it'll be safe because of the high airflow moving from the bottom to the top. She's asking, is it really safe, or should we only play tennis when it's outdoors?
Well, that's a great question. My wife likes to play tennis. We looked at the dome. We were asked to look at a bubble there too. And I think the air turnover rate in bubbles is relatively slow, and I think that's what's important. Yes, it's better that it moves from the bottom to the top than the top to the bottom, but I think it's the turnover rate in a bubble, and I don't know how fast it is in the bubbles where that individual is playing. The ones I was familiar with looking at is twice an hour, which is way below what we would recommend for being a safe environment. Now, having said that, it also depends on the density of people in that bubble. If 2 people are in a typical tennis bubble, which covers 1, 2, or 3 courts, if it's 2 people, I don't think playing that's fine. And you probably play doubles okay, as long as you know who the doubles people are, and they're or somebody on the opposite court. But I think you start getting more people in there than that. I'm nervous.
Yeah, I think there's no good exact numbers. I would say more than 2 people on a court. If you have a 3-court, when you start to put doubles on each court, that gets just more, and then you have more density. And there, people are breathing hard, they're running, they're exerting themselves. That can just put more virus into the environment.
And I think a lot of it depends on what are the safety protocols in place in that, and around those bubbles, who's coming into play, what's our screening like. I mean, there's lots of layers to that question. And then again, I come back to the room turnover rate. Bubbles usually exist because of the pressure they create. They have a higher pressure inside the bubble than outside that helps keep them up. And they don't tend to turn over the rate of air in there because they want to keep the pressure inside the bubble. That's why they have the doors that seal and things like that nature. So you just have to look at that turnover rate inside the bubble. It's not just about how the air is moving once it's there in the bubble. It's about how often you empty that air and bring fresh air inside. So
Nadine says a lot of people like to sit outside around a fire pit this time of the year. What about it? You still have to have a mask on.
yeah, that's a great question, Hawk. What are you thinking?
Yeah, I think if you can, spread yourself from the other people that aren't in your normal bubble, outside is certainly going to be more important than being inside and safer. If there's new people in your bubble and you're still around each other, if you're drinking, it's going to be hard to have the mask. But otherwise, I think we still would advise now to wear the mask, especially when it's people not in your household. If you can't separate, if you're outside for 8 to 10 feet, I think that's probably going to be the safest thing now, because more and more people are getting the virus, but they aren't understanding what their exposure is because it is just so prevalent in the community.
Yeah, I think that's a really important point. When you used to do contact tracing, we could kind of figure out where it came from. Harder now because of all those community events, and more people are sick around you, so it's more likely that you're going to have an exposure. And that's why your infection control, how you handle that, is becoming so important. And what that also means, to Hawkeye's point, that if you're around that fire, wearing a mask is probably the right thing to do. I guess if you're 10 or 20 feet apart, maybe not as big of a deal, but certainly if you're in that 4 to 6 feet apart, man, wear the mask.
All right, we want to have our 90-year-old family member join a 6-person Thanksgiving dinner. And besides masks and socially distancing, will fans circulating the air make it any safer?
Wow, that's a great question, Hawk. What do you think?
I think that's dangerous.
I do too.
I think that's dangerous. If it is, even if it's your own household, it's 5 people, and then the grandmother that comes in. If those are young people, again, unfortunately right now, a lot of people are getting the disease. We've had colleagues who have gotten the disease who do everything right, who don't understand where their exposure was. They aren't going out to large group gatherings. So especially if you have younger kids, we understand younger kids, get together more, do things more outside of school in just that group setting. It could be spread that way, and you just don't know it. We know a lot of people are asymptomatic. So because of that, I think just that situation can be a very dangerous situation.
Yeah, I think you just got to think a 90-year-old, my 88-year-old mother-in-law put the hammer down on our Thanksgiving plan and said, I'm not coming over for Thanksgiving, which is, she's pretty smart, and I think probably is making a wise choice. I mean, if there was a way to get everybody tested the day before, it might make you feel a little safer, but that's hard to do these days and hard to get that turnaround right away unless you have access to rapid testing. And so I think that's the only other way to think about it. But I'm with Hawk. I think it's just, you're just, man, there's a lot of virus out there today these days, and it just takes on a lot of risk.
Or have the fan, at the back of the.
Yeah, so that's even, so that thing
but
about
I mean,
airflow,
even those things,
it's just different. You're still inside the small house, and the fan's just blowing everything around, and it's not blowing it out of the house, and then that's a little different. So, Steph, what are you doing for Thanksgiving? Are you having a big party, or are you keeping it small and safe?
Unfortunately, our family is from Virginia, and so they typically fly in, but they're going to stay home this year, so it'll just be the 4 of us.
Okay. And are Hunter and Scott come over to the house for Thanksgiving?
I don't know. Probably they'll stay at their own house. Maybe virtually.
What are you guys doing for Thanksgiving, Hunter and Scott?
Well, we were hoping to go to Stefanie's house, but doesn't sound like we're invited.
Awkward.
Yeah.
Right.
So just us with our family, and I'll carve the can of Alpo.
Awesome. Ooh. I think Scott wants something different. You better work on that menu, big guy.
I'll just have pumpkin pie.
Yeah. I do think that, for Hunter and Scout and for all of us, we're going to make, these are hard Thanksgiving things to try and manage. And you just have to say, here's the level of risk I'm willing to take on, and here's what I know that'll be the safest, and try and do it like that. And I think still a lot to be thankful for. I think we need to be thankful for all the research work that's going on out there, and for things like monoclonal antibodies and vaccines, which tend to make us think that we'll be able to get back together by next Thanksgiving. And then I think we're just thankful that we're still here and alive, and while things are different and they're really hard, we're going to get through this, and I think that's something we can be thankful for.
Glenn is asking, is there any progress on rapid antibody testing?
Rapid antibody testing, huh?
It might be antigen. So rapid antibodies are not used for diagnosis of acute infection. We don't really understand exactly in the day-to-day clinical use what the use of antibody testing is. Rapid antigen testing, there continues to be more and more EUAs, or emergency use authorizations, for that. We understand that the sensitivity is still not as high as the PCR. One theory behind that is that you don't have enough viral concentration to be detected, and therefore not enough concentration to be infectious. So there does continue to be persistent research and development behind the antigen tests. Right now they are being utilized, but even still, if you have a negative antigen test, that really needs to be followed up with a confirmatory PCR test.
All right, Cindy is saying, yesterday the governor said Kansas had 500 deaths since the beginning of the pandemic through September, but we've had 500 additional deaths in the past 6 weeks. If this is true, how have we had so many recent deaths with improved treatments?
Yeah, I'd have to go find those numbers.
Yeah.
Are you aware of that number?
I am not aware of those numbers, but what I can tell you is that certainly we have seen the mortality or death of hospitalized patients, and overall the case fatality rate, meaning every case that's diagnosed, did those persons die. So really overall the case fatality rate has improved, but I think it's a combination of different things. I think it's a combination of the supportive care we give, not ventilating as soon as possible, but it's also a combination of remdesivir. Right now it doesn't look like plasma really is too beneficial, but I think also that depends on when in the disease process that was given. But dexamethasone has really proven to be very helpful in reducing mortality. And then of course the anticoagulation and trying to prevent or treat any blood clots that occur in the lungs and other places in the body. But then again, I also mentioned the supportive care, not trying to ventilate them, doing other things, the proning. There's been a combination of things to help reduce mortality, but overall we know that cases have increased. So that is one of the reasons maybe why the deaths have increased as well. In those rural areas in Kansas are hit harder right now than they have been 6, 8, 12 weeks ago as well.
Yeah, I think that's the answer, and I think that there's just a lot more COVID out there. Now, look, we know the death rates in the United States are rising, but the result, not the death rate, the rate of death and hospitalization is down.
Yes.
But the number of hospitalizations is way up, and so as a result, we're going to see more deaths because of that. And it's just, if there's more disease, then there's going to be more death, and we just, again, that we know how to do this. We did it in March and April. We bent the curve. We know how to do it. And as things get colder and people move inside, they still want to gather, et cetera, and be in big group gatherings. We just got to face it. We have to follow the rules of infection control because the rules keep us safe, Bob.
Sharon says Springfield, Missouri has a mask mandate, but we live in an island in the center of other places that don't have one. How would you talk to the city councils in those other areas to convince them to require masking in public?
That's a great question. All these are great questions. I don't know how you convince people to wear masks and to do that, whether you're in small town Missouri, small town Kansas, or quite frankly in our metropolitan area, because you see it. Right? And I think there's just people who just, A, they don't believe it, B, they have COVID fatigue, they're tired of it, they have COWS, COVID weariness syndrome, they have, or they're just angry and they don't want to be told what to do. All those things are at play here. I don't know how to convince an elected official that wearing a mask is a simple right thing to do. All I can tell you as Hawkeye and I've been here for 30 years. How long have you been here?
Since 2008 when I started
All
residency.
right, so 12 years. And Stephanie, how long have you been here?
6.
6 years, okay. So up here combined, there's like 44 years of being at KU. Pretty good math, pretty fast. You know, here's the deal. In our hospital, we have wards of COVID patients where we'll have, I don't know, 20 or 30 patients on one area. We have mask protocols, a mask mandate here at the hospital. Here's what we know. We don't have cases of our staff getting sick by being in contact with COVID-19 patients. Why is that? Not in the hospital, not on our wards where we have, you know, a lot of patients together. Why is that? It's because they're wearing a mask. So it's really a question of, do you want to stay safe or do you want to gamble? And it's funny to me that the hottest spots in the world are hospital wards full of COVID patients. And we know once we got the right PPE and the right protocols in place, we stop spreading it there. So the proof is right there. There is no better proof. People can talk about stuff all they want, but at the end of the day, the proof is right there. So we know masks keep people safe. And good infection control policies, washing your hands, keeps people safe. And yet folks still don't want to do that. And I don't know how to convince someone like it other than staying on message, keep pointing it out, and keep trying to get folks to understand that the next person who's sick could be them.
Yeah, absolutely. I mean, there, again, as we talked about initially, there wasn't a lot of COVID-19 specific data to suggest that masks are helpful. There was other infections to show that masks are helpful. We have more and more SARS-CoV-2 data now, you know, vetted, validated research that shows that. And it may just be a hubris. It may just not wanting to be saying that they're wrong. Nobody's wrong. Just as you said, do the right thing. It's never too late to do the right thing. You just got to keep giving your message.
And then just to say, some people try to undermine and say, well, science isn't real, and people doctors know what they're doing, and blah, 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 blah. Okay, well, here's the deal. If science isn't real, then why are we trying to get a vaccine? Why are we trying to get monoclonal antibodies if science isn't real? Why is the treatment of heart disease and cancer and cystic fibrosis and lung disease and everything else, why has it improved so darn much if science isn't real? Science is absolutely real, and we're just trying to tell you what to do to keep yourself safe. And if you talk to Anil Garmarkar, one of the patients we've had on this program multiple times, I think he'd tell you how important it is to follow those rules of infection control. Bob, time for one more question.
One more, all right. I've heard that we still need to wear masks and socially distance after we get a vaccine. Is this true? How come?
Yeah, I think we don't know the answer fully to that yet, Hawkeye, because there are a lot of layers to that. It depends on how safe and how effective that vaccine is, how many people have had the vaccine, how long it lasts, and lots of other variables.
Yeah, and for the time being, a vaccine, again, will not necessarily be a magic bullet. We still have a lot of data to gather from the trials, and then after it's marketed and people are using it, the post-marketing analysis. So it doesn't look like anything is going to change as far as that front. Still, the best way to stop the spread of the disease is going to be masking and distancing. Now, that data may change, and the conclusions may change, and so our guidance may change at that point. But right now, the anticipation is, at least until we can get further information about the mass populace when they are vaccinated and what the conclusions are, the thing to do is going to be to mask and to distance still.
All right. Well, those are all great points. Hey, tomorrow we're back. We'll be answering your questions with Hawkeye and myself and Amanda Gartner. Stefanie, final thoughts from you today, and remind us about how important the poison control line is and that number.
Sure. So we want to wish everyone a happy and safe Halloween. And remember to program that poison helpline number into your phone so you're always ready. And that's 1-800-222-1222. Thank you.
Thank you. Hunter and Scout, do you have final thoughts for us today? And thank you all for being on the show. Loved it. Now I got to go home and give my dog cat a hug.
Well, thank you so much for having us. And yeah, just want to say happy Halloween, everyone.
And be safe out there.
You bet. And Scott, one final question for you. My cat sheds a lot. Any advice on what I can do?
Let's see. Get a better vacuum cleaner.
Yeah. That's probably really
That'll
good.
take care of it.
That's good advice, I think.
Yeah.
All right. Hey, listen, send us your mask pictures and videos. This is the last chance for you to show us how you're going to use your mask with your Halloween costume. We'd love to see that. You know, it is getting harder. Well, we've been here before, and we can get through it again. We can bend the curve just like we have before. And we just need everybody out there to make sure they follow the rules of infection control. As we close, Hunter and Scott are going to leave us with this video with one more reminder about dry ice and candy, thinking about the whole Halloween deal. Be safe out there, and remember, you can bend the curve. You can do the things about keeping your distance, washing your hands. Don't go out if you're sick. Wear your mask. Stay safe, and remember, there is still no place like home. And hope is on the way. We'll see you tomorrow.
I've got spooky ice. Isn't it cool? I like it because it looks spooky.
I'll say it's so cool it could burn you.
Huh?
This ice is much colder than regular ice. Only adults should handle dry ice, and they should always wear gloves or use tongs. Never touch it with your bare hands. It could freeze your skin from frostbite and make it feel like a burn.
And don't try to lick it or put it in your drink.
Why not?
It's not meant for that. It could burn your mouth and throat. It's best to just watch it from afar and never get too close.
Well, I can't wait for Halloween. I'm gonna get so much candy.
Just remember to wait to open it after you get home.
Why?
Because a grown-up needs to check it to make sure it's safe.
I can help you, Scout. Remember, chocolate is poisonous to pets. We just want to make sure everyone is safe.
Oh, yeah.
You did really well. I think you're ready to go trick-or-treating.
Yes!
Come on, let's test your makeup and I'll draw you a vampire face. Ah. We understand that sometimes, despite our best efforts, poisonings can happen. Call 1-800-222-1222 right away.